Why are stomach cancer blood markers not always specific? Imagine trying to find a single sign that clearly says someone has stomach cancer. Unfortunately, blood markers used for detecting stomach cancer often fall short of that goal. These markers, like carcinoembryonic antigen, Ca19-9, and Ca70-24, are not unique to stomach cancer. They can also be elevated in other gastrointestinal cancers, such as colorectal or pancreatic cancer, as well as in benign conditions like inflammation or infections. This overlap makes it hard to tell if high levels are truly due to stomach cancer or something else. Another reason is that these markers are not always sensitive enough. Sensitivity means how well a test detects those who actually have the disease. For early-stage stomach cancer, these markers might not be elevated at all. For example, Ca70-24 tends to be more specific but only shows elevated levels in about half of stomach cancer cases. Carcinoembryonic antigen and Ca19-9 often have even lower sensitivity, which means they can miss many cases, especially early ones. So, even if the markers are high, it doesn't necessarily mean a person has stomach cancer. The biological diversity of stomach cancer also plays a role. Different tumors can behave differently at the molecular level. Some produce more markers than others, and some may not produce any at all. This tumor heterogeneity results in inconsistent marker levels across different patients, making it hard to rely solely on blood tests for diagnosis. Adding to the complexity, some of these markers can be produced by normal tissues or other non-cancerous cells. Liver function, for example, can influence marker levels because the liver helps clear these substances from the blood. If the liver isn't working well, marker levels might be falsely elevated or decreased, which can mislead doctors. Technical factors also matter. Variations in laboratory methods, the specific tests used, and how blood samples are handled can all affect the accuracy of marker measurements. These issues can lead to false positives or negatives, further reducing the reliability of blood markers for stomach cancer. Because of all these factors, medical guidelines do not recommend using blood tumor markers alone to diagnose or screen for stomach cancer. Instead, they are mainly used to monitor patients who already have a confirmed diagnosis, to see how well treatment is working or if the cancer has come back. Researchers are exploring new methods, like detecting specific DNA changes or new proteins in blood or gastric fluid, which might someday improve accuracy. But for now, the main message is that blood markers are helpful tools, but they are not definitive on their own. Always consult healthcare professionals for proper diagnosis and personalized advice, as each person's situation can be quite different.